Awesome. Well, I'm so glad to be sitting here with you both today, Tram and Jas, members of our TB and Refugee Clinic here at Santa Clara Valley Healthcare, or Tuberculosis and Refugee Clinic. Welcome, and I'm so excited to be talking about something that is very important, tuberculosis, and rather ending it. And we have Tuberculosis Day coming up, which this will premiere on that day. But we have plenty to talk about, so feel free to introduce yourselves, and we'll get right into it.
First of all, thank you for having us. And I will introduce myself. I'm Jas Mann, and I'm Assistant Nurse Manager at TB and Refugee Health Clinic. I have been with this clinic since 2018. I started there as a clinical nurse and later promoted to as an A&M position. Before going to TB clinic, I was working in VMC since 2001. So I have been a part of this system for more than 20 years.
Awesome. Well, thank you so much for being here. And Tram, hello.
Hi, everyone. My name is Tram Pham. I'm a resident nurse and a charge nurse in TB clinic. Before joining to TB clinic, I started to work at TCNU Valley Medical Center Hospital for several years. During that time, I float as extra help to PACE, homeless, urgent care, and TB clinic. I chose TB clinic as my home base because I used to be a patient here myself as a refugee receiving the latent TB treatment when I first came to the United States. Now I would like to give it back to the community, the best service that I had many years ago by being a team member in TB clinic.
Wow, that's phenomenal. So you've experienced the wonderful care at the clinic, and now you are a part of that care team.
Yes.
That's incredible. So again, welcome to you both. And tuberculosis, for those who are listening who may not yet know, or they may have heard the word tuberculosis, can you give us a brief overview of what that is and what we're going to be talking about today?
The way I explain to my patient is very simple. TB disease and TB infection is a huge difference. TB disease that you have symptoms, you have TB active in your lung, you need to treat it. TB, the latent TB, that means you have the sleeping germ. You may not know that you have it. It may not show the symptom, but it's very good that you need to get tested. And then doctor screen you, diagnose, and then you can prevent to become the active tuberculosis.
When we talk about TB, historically, people used to relate TB with lungs. So it's a chest infection. But it's not true. TB can happen anywhere. It can happen in your brain, it can be in the eye, it can be other body parts also. So a lot of time people think it's it's a generalized weakness, it's a normal fever, but it's always good to get tested. And when a patient has a TB disease, that means the bacteria is active and it's multiplying in your body. When we call it latent tuberculosis infection, as Tram mentioned, that bacteria is sleeping. So you can have a bacteria in your body and it can be in that stage for years and you won't even know it until the people get elderly or they have any other disease like renal or maybe diabetes. And that time when the immunity goes down, then this bacteria get a tendency to attack the body and become active. That's when the TB disease happen. And when the bacteria is in a sleeping form, as we mentioned, which is like a layman language, that's what is latent tuberculosis infection.
Okay, so those are two things that I personally did not know. I thought that you either had it and showed symptoms. I didn't know that latent TB meant that you could have it and not be necessarily displaying symptoms. And also, TB does not just affect the lungs and chest. It can be other places as well.
Yes. Mm-hmm.
So the clinic that you work at, why is it imperative that this service is offered here in Santa Clara County? Is this something that is prevalent here to this area? and what are we doing there to treat it, prevent it?
So TB is actually a preventable and curable disease, but yet we do have people worldwide and in our Santa Clara County dying with TB and having multiple cases every year. So if you talk about the statistics, you will not believe it that Santa Clara County is actually the third highest county in California for active tuberculosis disease, followed by Imperial and San Francisco County. And we used to be fourth, followed by LA and Orange County and San Diego. So that means there are other counties either are doing better or there's something for us to do better to bring this number down. If you look at the worldwide, there are like millions of people who are still getting TB disease and they're dying with it. So as in US and Santa Clara County. So there's something we can definitely do. And when we talk about Santa Clara County, our case rate is about 7 in 100,000 population. So we do have a lot of people in our California that are in Santa Clara County that do have TB disease. And when we talk about TB infection, per CDPH, there's 170,000 people living in Santa Clara County with latent tuberculosis infection. So it's very important for us to test, treat TB here in Santa Clara County.
For TB, how is it being spread to individuals? Is it similar to COVID? Is this an airborne disease? Can we talk a little bit about how we can prevent it, but first also understanding how it is passed on?
If people have TB disease in the lung, it's contagious by air droplets, by the cough. And if you close contact to that person, you may get TB. But if patients have TB in a different area, like in the brain, in the stomach, in the skin, in the lymph node, it's not contagious.
So prevention, the first thing is test and treat TB. So most of the time what happens is when people get sick, they don't realize it's TB. It's very important to go see your doctor. Latent tuberculosis test is QFT testing and, telling the doctors that you have these symptoms. And testing is the main key. And once we know that a person does have TB, at that point, home isolation. There's a very important part when they are infectious, during the infectious period. And our advice nurses, our charge nurses, when we find this patient is infectious, we do a lot of teaching to the patient and the family that they don't go out in the community without masks, so they're not spreading the germs. So prevention is the key because once we know the patient has active tuberculosis, they are in infectious stage, we have to do a lot of teaching, education.
Do you recommend that people do, testing, even if they don't have symptoms, because sometimes it can be latent? So is it recommended to just get periodic testing for this? So
I won't recommend periodic testing, but definitely, all those foreign-born people, or if you know that you have been in contact with somebody who's been diagnosed with TB, or if the person already have any other symptoms, like let's say they're HIV, they are homeless, or they have renal issues, or diabetes, it's important to do the testing at that point so that this latent tuberculosis can be, we can diagnose it and we can treat it. So it will not go to a stage where it will be an active TB disease.
Our clinic is not only provide screening, diagnosis, and treatment, but preventative treatment is very important. That we accept a lot of referral from patients have latent tuberculosis, which is the sleeping germ, and that on that stage it's very important that we educate patients take the prevention treatment, because we don't want the sleeping germ become awake and become active in the future.
So I'm sure there are a multitude of symptoms that would lead someone to think that they may have been exposed to someone with TB or may have acquired the disease itself. What are some symptoms that may present themselves in an individual that you would encourage them to go get tested then?
Sometimes they go to test it just because the job requirement. They don't have symptoms. And then we find out that the blood test or the skin test turn on positive. And we go further test for X-ray. Sometimes the patient been coughing for more than 3 weeks, and then the primary care doctor give antibiotic or whatever medicine that he needed, and then the symptom not go away, and then they test TB test, and they find out that patient have TB infection first. Some cases that patient coughing for a long time, and they find out that patient have active tuberculosis right away based on the X-ray, on the sputum test.
There are a few symptoms that we can actually pay attention to. Most of our active tuberculosis patients, as Tram mentioned, they have cough, they have fever, and weight loss. So if they have been losing weight and they have been having fever, and especially the nighttime fever when they have a lot of sweating. So these are the few signs for active tuberculosis that, and they have been periodically losing weight for a couple of months. It's important that they should go and see a doctor.
So if somebody does test positive and they are seeking services for treatment and they come to our clinic here at Santa Clara Valley Healthcare, what is that process like, and how should they expect treatment to go once they are admitted to the clinic?
The TB clinic is a part of Valley Specialty Services, and we are a referral-based clinic. So the patient, usually what happens is when anyone has any kind of symptom or thing, they go and see the primary care doctor. So the first testing is being done by the primary care, and once they know that their blood test or skin test is positive, their X-rays are abnormal, then they refer the patients to us.
Okay, so once they're then referred to the clinic, what does the process look like for treatment, and what is kind of the roadmap that someone should expect? Because I'm sure that is a very scary time for someone to experience a positive diagnosis. So what is something that your team does to first kind of get them to understand more about the disease and then understand that they are in the best hands getting the best treatment?
When we receive the referral from the primary care physician, we have staff sort out the paperwork for the referral. They very good job on screening the referral paperwork and forward to the MD team to review. And our doctor review the referral based on the doctor note, the symptom on the attachment of the X-ray, TB skin test, additional information we can evaluate if this is an urgent referral or not. On the other hand, we have some patients just walk in straight to TB clinic without referral. They just end up in TB clinic because they have no healthcare access. They coughing, they tired, they looking for help. And then we have the nurse in TB clinic that triage the patient, symptom review. We talk to the doctor. We have financial counselor team here screening the insurance process. Sometimes we redirect back to primary care doctor to process the referral paper and then see patients soon.
So I want to dive deeper into kind of what we're on the tail end of here with the COVID-19 pandemic. Mm-hmm. How did treatment look like at your clinic for people testing positive for TB in the middle of another very trying time with COVID-19? How are people still getting treatment then?
During pandemics in the past, we're very proud that we remained open, the clinic, and then we see the patient in-person appointment. We call the patient screening on the phone, and then if needed, we have the X-ray room in TB clinic. We get the patient in TB clinic for X-ray for doctor to review. We have the sputum induction. We still accepting the patient during pandemic to collect the specimen, the phlegm, and then triage patient. Basically, we work at the same like before pandemic. Yeah. We're so proud of TB clinic that we opened the door for everybody during pandemic. With the additional COVID precaution, we're screening people, but I think it's more than 60% that we see patients in person.
So what happened was a lot of time during the pandemic, people were having the fever. As you say, most of the symptoms of COVID-19 were same as tuberculosis. So people were not going to the to see their providers when they have some symptoms. So the number actually, TB number, diagnosis number were decreased during the pandemic, and which we have seen it rising now because now as the restrictions are getting over, the people are getting able to get the healthcare, more accessible healthcare. Now there are more diagnoses. So TB numbers are actually increasing as we are going out of the pandemic. But from the TB clinic standpoint, we remained open, and we were continuing to provide the best care to our patients. We were the first one, actually, one of the first clinics in Valley Health Center to start the video visits so that we can accommodate our patients, and obviously the telehealth visits. But we are so proud of our team that we really didn't impact. We were open for our patients, and we were always welcoming.
That's incredible. I think that is something I've seen across this hospital and clinics, that we have so many dedicated healthcare professionals that are really going to be there in times of non-pandemics as well as in the middle of big pandemics as well. So that's great to hear. And for people who are listening to this who are maybe getting nervous about, have I been exposed to someone? Am I, feeling something that could be considered a symptom of tuberculosis? Can you talk a little bit about who is most at risk, and if there are any other, risk factors to consider, and then any other, disparities that have caused this to be more common in certain demographics than others as well?
From my experience, I believe the healthcare disparity are people low income, language barrier, and the elderly patient. Patients from low income families, they often have issue with food, lead to malnutrition. On the other hand, with the high renting costs in the Bay Area, they are living in the crowded, poorly ventilated space, would increase the risk of TB infection. For people with language barrier or are elderly, lead to very limited access to the healthcare resources for treatment or diagnosis. Would you like to add something?
Yeah, so when we talk about the healthcare disparities, definitely we do have. If we talk about the active tuberculosis disease, 81% of our patients, they are Asian, and 14% they are from Hispanic background. And when we talk about Asian or Hispanic background, I'll say about 67% of these patients are coming from who are actually foreign-born, either in Philippines, Vietnam, India, China, or Mexico, or they have migrated within the last 10 years to U.S. Then comes our patient who has secondary diagnosis, then homelessness, as Tram mentioned, and patient with HIV positive, or they are on dialysis, or they have any heart issue or diabetes. Any kind of immunocompromised condition can then give the bacteria the chance to multiply in your body and develop a TB disease.
So there are a wide range of things that lead to positive TB tests, unfortunately. But when we talk about what we here at Santa Clara Valley Healthcare are doing, from the healthcare workers to leadership, what are we doing to help mitigate these risks and to be there in support of the community? And I know there's also an incoming new facility, if you can speak to that as well.
Sure, thank you. So Santa Clara County, as I did mention, that a lot of TB is happening with Asian population. So if you look at the last census, there's like 45% of the population is Asian origin, and about 25% is Hispanic origin. So we have a very large reservoir of patients who are either suspect to TB. And when we talk about the age, we have about 65% of patients, they are in a high-risk age group. So it's very important as a county, as a healthcare system, for us to work together and test and treat TB. I would like to say thank you to our leadership. As most of people know, that currently we are in a public health department building, but with the support of leadership, we have actually received a new building. We are in planning of building it or transitioning. And the transition is going to happen by the end of this summer, we will be moving to our new building. It's going to be at 1996 Lundy Avenue. It is going to be a state-of-the-art, fully negative air pressure building. I'm so proud to say this thing, where we can actually test, treat, and we can prevent TB from our other patient and from staff from this. Because as you know that even if you have to go as a regular patient or regular healthcare worker, and somebody will say you're going to TB clinic, people have the stigma, and a stigma is there. And knowing that this is a best facility, state-of-the-art facility, we want to decrease that stigma. And we are so thankful to our leadership team to having us, giving this opportunity to move. And at the same time, the clinic is going to be way bigger, so we will have the opportunity to expand services. Mm-hmm. So currently we are seeing about 60 to 70% of the active tuberculosis patient in Santa Clara County, and we are hoping to see all. So obviously if we introduce ourselves in the media and everywhere, so we want all the other private provider who are actually providing the care, we want them to refer their patient to us. And definitely we are looking for this opportunity. We are looking for an RN coordinator who can coordinate the care between the public health department and other specialty centers. So the patient, because as Tram mentioned, a lot of our patients, they have their primary language is not English. So it would be very important to have a care coordination who can support these patients, so they can get care not only in TB clinic, but also with all the other specialties within the VMC. We would love to have a behavioral health counselor or a social worker, because what happens is when the patient is in the active phase of their disease and they are infectious, we don't want them to go to other valley specialties, because we don't want to expose other patients. So we want to see whatever care we can provide under one roof is the best for our patient, and at the same time is safe for the community.
I know that there is a date coming up that we want to highlight, World TB Day. Yes. On the 24th of March. Mm-hmm. What does that day signify, and what do you see for the future of TB?
So we have World TB Day coming on this Friday, March 24th. That was a day in 1882 when Dr. Robert Koch discovered the bacteria, which is the cause of tuberculosis disease. So this day is celebrated to raise awareness about the TB disease. So if we talk about overall for the whole world, as I did mention, about 10.6 million patients are still getting TB disease worldwide every year. So this year, the WHO has they want to raise awareness, and they want to say, yes, that's the motto for this year, yes, we can end TB. And the goal is to decrease the new cases by 80% by 2030. So same as here, we want to work towards the same goal. We want to put more emphasis on prevention versus treatment. As we can say, this is a preventable disease. So I will say it is really sad to see people dying with a preventable and curable disease. So our main emphasis is to treat and prevent LTBI.
That's why I'm so excited to be sitting here with you both today to be talking about something that, again, is so treatable, and we can get people the resources they need to live healthy lives and to not die from tuberculosis. Anything to add to that? March 24th, big day. How are you feeling going into that?
I feel so proud that I'm a nurse in TB clinic. We work together. We want to send the message to everyone that unfortunately, if you diagnose with TB, but fortunately, the disease is curable 100%. And welcome to TB Clinic. We open the door for everyone. We're here for you. We provide not only the better health, but we're here to support you. We have staff speak several languages, certified for translating in Vietnamese, Chinese, Tagalog, Spanish, Hindi, Punjabi, and Farsi. And we also support for people who have problem with transportation. We provide taxi voucher. We try to coordinate with public health to get you in as soon as possible. We have financial counselor team, very excellent to screening you for insurance. If you don't have insurance, we coordinate with community public health to make sure patients have some sort of support for TB medical program. And last but not least, we want to make sure patients go home with TB medication. Nobody can go home without medication. We do our best. And then we have the excellent nurse team there that we on the phone 8 hours. We answer on the concern, any issue, any question. Even patient walk in, we screening the patient very good on that.
I love that. We're getting patients all of the resources they
Yes.
need at a very trying time in their lives. And I can hear the passion when you talk about it as well. And Jas, I'm sure you can echo some of the same emotional sentiments as well.
Yes. So I will add to this, we have a very committed and passionate team of diverse team of our doctors, obviously nurse practitioners, we have lab technician, x-ray tech, we have a communicable disease investigator, office staff, we have LVN, PHAs, and not to leave behind the nurses, wonderful nurses team. They work as a charge nurse, they run the clinics, they do triage for walk-in patients, and about to add TB clinic also do the advice call for our TB patients.
All right. Well, again, this has just been a phenomenal time getting to hear more about what your team is doing to combat tuberculosis. I think there's even a tagline that your team has, right? Yes, we can end TB. Am I getting that right?
Yes.
Yes.
Yes, we can end TB.
I love that. Very, very beautiful words. And I just am so proud to work here, getting to hear these stories from kind and compassionate healthcare individuals such as yourselves. Is there anything else that you would like to add today on this episode of The Beat?
Yes. So I would like to add, as we say that, yes, we can end TB. It's curable and preventable disease, but it's up to the people, right? When you know that you have some symptom, don't ignore those symptoms. Go see a provider, get yourself tested. And I want to add something that last year with the support of our with our compassionate team and our management team, we were able to introduce the QFT testing in primary care setting for some highly suspectable patients, like who are foreign born, or if they have a renal issue or diabetes, or they have HIV or some others. So obviously we are getting a lot of referrals from primary care, and we are thankful to the primary care team for testing and referring those patients, because the testing is the main key. Once we know and once we can diagnose a patient who has a latent tuberculosis disease, it's better to treat them right now. But if you count at future, about 10% also of those latent tuberculosis patients actually will develop a TB disease sometime in their lifetime. So if we treat the latent tuberculosis, 90% the chances that we will be able to treat that and the patient will not have a TB disease in their lifetime. So it's very important to test and treat the latent tuberculosis so we don't have to see TB disease.
There's definitely a game plan there, and that's very heartening to hear as somebody myself living in Santa Clara County, that we have this dedication to better health for all and making sure that people get treated when they have TB. So.
And I will add over here also, because I know that most of the time what happens is in Santa Clara County and our high-risk population, sometimes they are very unfortunate. They can't drive, or they're looking for a care which is close to home. So we actually have our satellite clinics they're providing latent tuberculosis at downtown, at Vasque Center, Milpitas, and Gilroy, and at Moore Park also. So our nurse practitioners, they go different places, and we take care of latent tuberculosis patients at different locations.
Yeah, people can absolutely, that's a great point. People can access all of the information on our website at scvh.org, where we can find all the information about where the clinics are, what treatments are offered, and we'll make sure to put all of the contact phone numbers and website information in the description of this episode. And Tram and Jas, we thank you so much for coming on The Beat today. World TB Day, March 24th. Everybody get involved, and together we're going to end TB.
Thank you for having us,
Thank you.
Thank you for giving us an opportunity to highlight our program. Thank you, Nick.